Hey guys, it's Dr. Emer. I'm super excited to be here because I have this gorgeous client that's here for just enhancement. And we're gonna do fillers in the first step, and we're gonna do some tightening and brightening in the second step. In step one, if we take a look at her face, she already has really beautiful facial features. She has big eyes, lifted brows, nice lips, small nose, but we wanna fine tune each of these signature features. I wanna bring her chin out a little bit, elevate her cheekbone, giving her that heart-shaped look. And then I just want to define and sort of outline her lip to give her more structure to the face. And then if you look from her profile, her lip and chin come out a little bit further than her nose, so bringing the nose forward slightly would help give her a better profile overall. So we're going to do female facial sculpting. This is more about enhancement than it is about volumization. Especially in an area like here, she already has larger cheek. We don't really need to give her much more volume in her cheek. We really just want to give structure so that when she's wearing makeup or not, you see that elevation, you see it pop. And by defining the lateral cheekbone, we can really get a nice amount of structure. People call this the heart-shaped look. This is where we elevate the upper third and upper, middle, and third of the face, and then we project the lower third of the face. So you see just that little bit of enhancement really makes the cheekbones pop. And we want to bring it out a little bit further so it really stands out. We want it to kind of come off in this little tail, as I say here. So you see that's elevated right there. We're now going to do the other side, do the same thing. We're using a really good filler called Define. This is a Restylane Galderma product. The reason I like it is it moves a little bit better with you, and it has a little bit more stability in this area. But for the price, you get at least a year's worth, if not longer, and a very soft but structured look. So it looks very natural. And you guys see already, look at that height. And so obviously we need to really watch the height of her. Because there's different angles at which you can really define someone's face. So I'm looking at the top of her ear, going all the way down to the edge of her lip. And that really helps us make a decision as to where we want the height. And I want to be strategic because when you already have a little bit bigger of a middle face, or you have a little bit more volume in your cheek, to really get the lateral cheekbone to pop out, it does take a pretty good amount of filler. So we want to make sure it's really all structured right here to literally elevate and lift. And it's going to complement any of the threads that we do because it's going to lift that area. Now I'm gonna work a little bit on her chin. This is the area where I'm telling you, every girl, no matter what we do, loves having the chin. I feel like if you ask my entire staff, they're all gonna say, you can't live without it, exactly. The chin is in, that's what they always say. I feel like that and lips, the girls always want. So I wanna do a little bit more of what we call a 3-point technique. From the other side for the other, where we focus it all really right here to bring that projection forward so that it really balances with the elevation of her cheekbone. You can already see that change. But what's nice about this, you guys, is it's not different. She just looks enhanced, and her eyes and lips are striking, her whole sort of face and overall appearance. So this is just going to make everything pop. You guys see, look at even that right there, look, it just brought everything together. If you come and look at the profile, now take a look at that. Look at the difference. So I'm gonna do another technique now, and at Emer University, when we do our training program, we talk a lot about what I call the bow tie area. That's this area right here. And so if you come to Emer University, you guys can check it out, emeruniversity.com, and train your face just a little, perfect. We're gonna do a little volume through here, and that will give support to the lip and chin and give her a little more definition in her jowl. Okay, feels weird, shouldn't hurt, but just feels strange. Can't wait to do an Emer reveal on this one. This will be really good. You don't need a lot of filler in this to really give a nice improvement. But by doing this sort of strut through here, we support the corners of the mouth, we support the jowl, and it gives a nice smooth balance between the rest of the jawline and the lower face. Okay, perfect. So now we're going to do the other side. Thank you. Turn a little bit this way. She's doing great, not even a flinch, just a little bit of a smile. I love that because fillers can hurt, but we're trying to be as gentle as we can using our cannula right now. This area tends to be more of a higher, the light, you guys are gonna move the light. I can't see. No, because the light, there we go. Hold on. It's okay. Sometimes the skin is just really good. It closes. There we go. Okay, so we're gonna do that same thing. Just a little support on the jaw, very little, because you don't want someone to look puffy. You want it to be structured. A little support through this area that supports the marionette area, the corner of the mouth.
Someone asked, can you combine this with other treatments? Absolutely.
Yeah, we're gonna do that today. We're gonna do laser and threads for her. So this is step one. We're going through the depth, the deeper area first, which is our filler. And again, very small amounts. You can always add. But now if you take a look at that. Really blended, really contoured, really structured. I love this. Now let's focus on her middle face. So let's do her lip a little bit. And now we're gonna switch to a different filler called Velour. I like this one because she already has lip in terms of volume. We just want a little more shaping, a little more poutiness. Velour is nice because it'll last and it'll allow us to turn down her lip and give her a little bit more of the balanced volume which I wanted. So naturally, she has a tendency to have a little more volume there. So we're not doing a lot, we're just kind of contouring. And I like this filler a lot because it lasts over a year. It's a little bit of a softer look. When you kiss her lip, it's not gonna feel like something's in there, which I love. Perfect. So now also to give her a little definition. Perfect. I'm gonna lean her back just a little bit. Just watch her, make sure she's not bleeding. Perfect. I'm gonna tilt her just a little. Perfect. So I'm gonna tilt her here. And this will allow us to get a little bit more elevation in the Cupid's bow. More in the midline. So I want her to have a little more definition through this midline. So that you guys can see, if we look in the front now, it's a little more turned up in the middle. There we go. And perfect. And get a little bit more downturn to the lower. Smile for me. Perfect. So you guys can see, go ahead and relax. The lining of her Cupid's bow is much more defined. There we go. Perfect. And a little bit on the chin crease. Okay. Last part, the nose. This really brings everything together. But my main focus with her needle is to really just project the tip a little bit. We're not going to do too much. Is I just want to bring this forward just a teeny bit so it's a little bit straighter for her. I feel a pinch, 1, 2, 3. So we're going to go towards the central cartilage and the septum. Go ahead. Good. Grab there. Hold on. Count of 3, breathe out. 1, 2, 3, breathe all the way out. There you go. Good. And this is a safe technique if you're using the cannula. It's a little bit more risky if you're not using the cannula. So I want to give a lot of septal support. So this will be filler that's going to be used to upturn the tip of the nose and project it forward. It's going to push it forward a little bit. I don't want to upturn it too much because she already has a good nasolabial angle. But this is gonna just kind of project it a little bit. There we go. Perfect. Very good. Now, we did a little bit to the tip to just elevate the cartilages. And again, remember, this is a area you really gotta know what you're doing with filler. Perfect. And one last part. Very important when doing the nose. Okay, you're really cautious about how much filler you do and where you do the filler, because you don't want to put her at high risk for any vascular issues. So doing very small amounts at a time. And in the right plane.
Someone asked for the nose, are you using Define?
No, this is velour. So if you guys take a look, perfect. So that's really good. I don't even think she needs more than that. At least it has a little more structure here, a little more lift right here. And since a lot of Asian and African American noses are a little flatter in this radix area, giving some support there helps elevate the bridge. And just helps support overall look. Okay, so we finished. Let me wipe her down. You know what the next part is? The Emer reveal. I honestly think you look incredible. Oh my god. This is like game changer. What's funny is you don't look different, just looks a little better. We got tears of joy here. No, it's the automatic tears you get from injecting around the nose. All right, give her the phone. Let me raise her up a little bit. Take the phone and take the camera about 45 degrees. So hold it like this and take a look. All right, what do you think? I'm gonna show you in the mirror in a second, but look at the cheekbones, look at the chin. I want you to look on the angle a little bit. So a little bit more of a slope with projection, balancing of the lip. Remember I was saying one was a little bit bigger than the other. Chin brought forward a jowl, and then a little height to the cheek. I even think in the future we can even, you're able to go a little bit more if you wanted, but just straightening the bridge so that it looks straighter.
Ooh, wait, gorgeous.
And the lips. What did you want? What was the goal?
This.
I feel like that needs to be the answer. What did you want? I got this.
This.
But like, what do you
That's
think is beautiful in a
gorgeous.
woman? Like, what do you like?
Like,
women?
I love the nose. I love the.
Here,
it's
look.
like.
Is that the up close or is that the far?
Yes.
Hold on, do this side, this side. There you go. Now take a look.
Oh yeah.
It's a little swollen, but that'll go down.
Ooh, wait.
But what do you think?
Absolutely gorgeous.
Yeah, it is. So basically, you guys, our goal was enhancement.
Wow.
Even though we did a number of syringes, it was about enhancement and not about volumization. She already has volume. It's preventing the laxity, which we're going to do with some threads,
Nice.
but also just contouring. Now we have height in the cheeks. We have a little bit more of a slope with a straighter bridge. We have the chin coming forward and supported on the jowl and here, and then look at her lips are balanced. Before, her lower lip had much less volume. Now it's a lower lip is bigger than the upper lip, which gives it a more beautiful look in terms of what we feel is the signs of beauty and proportions. So that's it, you guys. We're gonna do some pans, beautiful female facial sculpting.
That's nice.
So now I'm gonna let you guys do your test.